Good morning and welcome to Madison Global Health Institute's monthly webinar. My name is Calyn Ostrowski and I serve as the Associate Director of Strategic Partnerships and Development at GHI. Thank you for joining today's discussion titled Madison Microneurosurgery Initiative to Improve Global Health. GHI is a transdisciplinary initiative dedicated to advancing the health and well-being for people and planet through research, education, and collaboration. We coordinate, connect, and incubate efforts across disciplines and sectors to address the world's most pressing health challenges. Our monthly webinar series features researchers and practitioners from UW-Madison and around the world, highlighting the complexity of global health challenges and the diverse expertise needed to address them. Before we jump in, a couple of quick housekeeping items. First, we are recording today's session, and the archive video will be available on our website at ghi.wisc.edu. And second, we are monitoring the Q&A section and chat, so please post any questions or comments for the panelists there. We will do our best to address as many as possible. Today, we're exploring an inspiring story of innovation, creativity, and global collaboration. One that began with a simple but profound challenge: the lack of access to microscopes and microneurosurgical training in many low and middle income countries. Through the leadership of Dr. Abdullah Keles and the mentorship and support of colleagues across UW-Madison and beyond, the Madison Microneurosurgery Initiative, also known as MMI, has become a powerful model for how academic institutions can expand surgical training and strengthen neurosurgical care in underserved regions. It is my privilege to moderate today's discussion and introduce our panelists, each of whom brings a unique perspective on how research, training, and global partnerships can transform health outcomes around the world. We begin by welcoming Dr. Mustafa Baskaya. Dr. Baskaya is a tenured professor and the Robert J. Dempsey Professor of Neurological Surgery at the University of Wisconsin School of Medicine and Public Health. He directs the Skull-Based Surgery Program, the Lincoln Ramirez Neuroanatomy and Microsurgery Skills Lab, and the Fellowship in Cerebral Vascular and Skull-Based Surgery. His clinical focus is on skull-based tumors, cerebrovascular surgery, and complex brain and spinal cord procedures. Dr. Baskaya's research explores brain anatomy variations and safer, less invasive surgical approaches. He holds key national and international leadership roles in neurosurgery, including positions with the American Association of Neurological Surgeons, Congress of Neurological Surgeons, and the World Federation of Neurosurgical Societies, and served as past chair of the International Division of Congress of Neurological Surgeons. Welcome and thank you for joining us today, Dr. Baskaya.
Thank you, Calyn.
Next, we welcome Dr. Abdullah Keles. Dr. Abdullah Keles is a physician scientist specializing in microsurgery education and neurological surgery training. He develops affordable, sustainable training models for resource-limited settings and advances surgical education through hands-on programs and simulation tools. To date, he has distributed 149 training kits to 69 centers in 38 countries and led workshops worldwide, working to bridge gaps in surgical education and promote global health equity. Welcome and thank you for joining us, Dr. Keles. Next, we welcome Dr. Yannick Canton Kessely. Dr. Kessely is a specialist neurosurgeon at Renaissance University Hospital in Chad and serves as head of the Department of Neurosurgery at the University and Health Science Faculty at NJMINU. He is an international fellow of both the American Association of Neurological Surgeons and the Continental African Association of Neurosurgical Societies. Dr. Kessely is actively leading efforts to develop and expand neurosurgery, a recently established specialty in his country. Welcome and thank you for joining us, Dr. Yannick. Now let's dive into today's discussion by starting with you, Dr. Baskaya. Thank you again for joining us. Could you please share your perspective on the evolution of the microneurosurgical training and how mentorship shapes innovation in the field? And for the audience, Dr. Baskaya does have to leave right after his presentation, so we will take a few questions immediately following his slideshow. So over to you, Dr. Baskaya, and thank you so much.
Thank you, Calyn. Thank you very much. Let me share. Thanks again. Good morning. Thank you for having me, and thanks for this initiative. And I'd like to thank all the organizers and the Global Institute of UW Medicine. I have no disclosures, and the when I start working here at the UW in 2006, I moved from the University of Miami. There was an international fellowship program there too, but it wasn't very structured. And I noticed that there's a problem training these international fellows. And then another thing I noticed is wasn't it it didn't seem very sustainable to continue that. So when I came to University of Wisconsin Medicine, first thing I asked, having a anatomy dissection lab, cadaveric lab, so we can do this kind of trainings not only for our residents and fellows and medical students, but for the international students, fellows, residents, and even the international neurosurgeons. So at VA Hospital, we started as a one station lab, very small room, with the old type of microscope. And our two residents and the first international fellow, currently he holds the chair position in his country, and these are the first three participants of this lab, and that they are dissection the cadaveric head to learn how to be more efficient, proficient with the neurosurgical approaches, neurosurgical procedures. Due to the demand and increased demand, and then the success of the program, 4 years later, we moved to the fourth station lab, and currently in 2018, we have like this 10 station state of art micro neurosurgical anatomy and microsurgery lab, where we practice not only the cranial neurosurgery, spine, peripheral nerve, endoscopic neurosurgery, and where we hold our national, international courses. And this is the detailed picture of showing that these are the buckets we keep the cadaveric heads, and these are the stations with the true operating room microscopes we obtain through the donations or philanthropy, and all kind of surgical instruments available in the real operating room we have in this lab, and 3D monitoring systems, and the other instruments. So this was the beginning of it, and it's currently spread to the current condition. And we established with the help of the UW Health, established the Global Neurosurgery Research Fellowship Program. If all participants come for different purposes, we structure their time at UW according to their needs. Some people come from the middle income countries, some fellows come from the low income countries, and then the duration is 3 months, 6 months, 12 months, and sometimes 2 years. We sit down ahead of time. We make the plan, but when they come, we sit down again, structure their stay according to their needs and their desires. So it starts with we established a microvascular bypass training curriculum. We ask them to perform this as many as they can. This is a very good practice, and not available even in many centers in the United States, or even in the developed world. But so they were amazed with this first, and then they try their best to get better. And then we have a scoring system they can score themselves to improve even more, and we evaluate that data periodically to help them if they're facing any problems. And then they also observe the real surgeries in the operating room. This is a one Saturday. I was performing a very complex surgery. You see is a panoramic view. Here I am sitting with my fellow and the chief resident, and all these neurosurgeons from all over the world watching the surgery live and learning seeing it right away, right there when it is performed. And then they also perform the cadaveric dissections in a planned manner. And we have cadaveric heads and the cadaveric spine and the peripheral nerve parts of the body. They can practice the peripheral nerve, and they participate in our annual courses. And when they become, once they advance, they can be co-directing and the faculty or instructor in these courses. This is what how I started. That is in the current form. We ask participants to simulate the microvascular anastomosis. It starts with the 6-O-prolin as a little rough suture, is not very micro suture. And if they perform well, they go to the 7-O, and they have to do certain practices to pass the score so they can go to the next section. Next section is the fake vessels. These are the simulating the real arteries and the veins. There are different sizes of this. They do much smaller needles and the sutures that you cannot see actually with your naked eyes. And then they do, we have a chicken thigh model, and they dissect the chicken vessels, and then they do the same. And then the rat model where they perform these surgeries in the rats. And then when the end product is this. So this is for example, one of our medical students started very early, even before medical school, and see how it's perfected when he's MS 2 or 3 years. So can you imagine starting early practicing how he's gonna be when he finishes training, when he enters the neurosurgery training? He's gonna be doing much better than anybody. So this is how it should be. And we also develop alternative practice methods. Sometimes when they do these cadavers, rats may not be available in their home country. So we develop a grapefruit model. For example, they dissect the grapefruit like dissecting the brain hemispheres, and they laying down to the small vessels in between these grapefruit lobes, and then simulating the brain lobes and the vessels, and they practice in the grapefruit like they are doing the surgery in the brain. And same with the other models, gel models, and we publish this extensively. And this is again the same picture showing the OR and clinical observership. And then what happens? They only do not they only perform these practices, they also do research. They extensively published, and that helps their promotion. They learn academic neurosurgery. When they establish their own department, that they can develop and shape their department according to the trainings and academic trainings they received here at the UW. And these are the cadaveric dissections showing the different parts of the body, head, spine, peripheral nerve, and I am showing them how to do it, and so they can do it, and with the real-time operating microscopes. And we have many hands-on courses. Now it's the skull base and the microanastomosis course even accepted as an international, and many participants even from Japan and advanced countries, they come and observe these techniques, so they can perform the same thing in their home country. And this is my international fellows. One of them is going to speak soon, Dr. Kessely, Yannick, and from all over the world, and mostly low and middle income countries. And again, not only they come, sometimes I go visit their home country and see how they are doing, how they are performing. And for example, this Dr. Chan now became the director of his own hospital. He's ex he's becoming a star neurosurgeon, and many neurosurgeons from Africa, they come through the Finns and Taiwan, China, Russia, and Kazakhstan, Turkestan, all over the world. And this is the our motto. You have to spend some time in the lab if you want to be proficient in neurosurgery. As Confucius said, you hear, you may forget, you see, you may remember, but when you do, you understand much better. When you do these practices in the lab, you do much better in the real time in the operating room and when you face to do complex neurosurgical problems. And since 2006, we hosted more than 400 fellows, international fellows from now probably more than 50 countries. And we like to continue this. And thanks to the help from the UW Health and University of Wisconsin Medical School and all the participants, we like to carry on the flag even further and spread this and make it more sustainable. So not only the ones they can come, they can afford to come, but how we can train them in their home country without them coming here. And I think Abdullah is going to talk about that initiative. So I'll stop here and I'm happy to take any questions. And thank you for your time and listening.
Wonderful. Thank you so much, Dr. Baskaya, for that insightful foundation and for highlighting the evolution of microneurosurgical training and just what a wonderful example of the Wisconsin ideal worldwide. We do have a question for you. Can you speak to the feasibility of supplying human donors, cadavers, for your program? As a member of the UW Body Donor Program, we are experiencing a shortage of donors.
Uh, we are experiencing the same problem. We obtain these cadaveric heads from the anatomy department or private organizations, industry. They are having the same problem, and we need to be very mindful about how to use them because in the past we had so many of them, we could perform all these practices. Now we need to be a little more careful, and but that's definitely a major problem.
Thank you. Thank you. Not seeing any other questions in the chat. I have a question for you, Dr. Baskaya. Are there any scholarship options available for international colleagues who wish to participate? And what has surprised you most, either positively or negatively, in building a global training network from Madison?
There is no direct financial support from us as a department or institution, but there are some other institutions like a FINS, Federation of International Neurosurgical Education, and we get many scholars from this institution. They provide certain amount of stipends and scholarship, so at least that covers some part of their expenses while they stay here.
Great. Wonderful. Well, thank you so much for your time today, Dr. Baskaya. This was really wonderful, and we look forward to staying in touch.
Thank you,
so
Calyn. Thank you very much.
Thank
You have a
you.
wonderful day. Bye-bye.
Thank you. Great. Now with that, I'm pleased to turn things over to Dr. Abdullah Keles, whose work builds directly on this tradition. Dr. Keles will share how these principles inspired the creation of the Madison Microneurosurgery Initiative and how the program is transforming training opportunities worldwide. So Dr. Keles, over to you.
Thank you, Calyn. Let me share my slides. Can you see the slides?
Yes, so you can see the slides.
Okay.
There you go.
Yeah. Thank you. Thank you for the organization, Calyn and Katie. It's wonderful being here today with you and with all the participants. My name is Abdullah and I'm going to briefly mention about our laboratory's global outreach program that we initiated a couple years ago. I have no conflict of interest. Since late 1960s, modern microsurgery techniques have transferred enormously in neurosurgery, but these advancements in neurosurgery have not been evenly spread worldwide, and over 5 million neurosurgery cases unmet in low and income countries. So the absence of microsurgery laboratory training and trained professionals with microsurgery techniques in low and middle income countries contributing in that unmet gap. So in 2020, we found the Madison Microsurgery Initiative at the UW Medicine under the guidance of Dr. Dempsy, our chairman, and Dr. Baskaya to establish training centers in low and middle income countries and deliver them live stream, offline, and in-person training opportunities and enable the locally driven sustainable microsurgery education in those countries. So here's very brief our approach. We collect microsurgery training kits in our institution and donate those, transfer those kits to low and middle income countries using multiple different approach and support those institutions with live stream, offline, and in-person training sessions. So this is how we do it very briefly. So the first thing that we did, we come up the idea that, okay, what we need for such laboratory training. So that's something like missing in the even community. So we test out lots of different microscope, instruments, light source, everything that the basic things that we need for microsurgery and come up with a basic set. And those are the microscope that we use mostly Surplus microscope, maybe 30, 40 years old, but in really good condition and like with high quality optics. And this was like basic sets after all our experiments. And we have like one stereo microscope, one light source, and one tweezer sets in like less than $50 training kit. And that's most basic microsurgery training kit that we need. And we start sending out those kits and also combine with other surgical instruments. And this is how we send those kits. We start with the fellows who is visiting us in our laboratory that we train here. Whenever they are going back, since they have some training with us, we gave them some training kits, surgical instruments. They took them back to their home countries and start to teach their residents, their colleagues, and start to perform those surgeries in their home countries. Also, like here, another example, like how we collaborate with the all other NGOs. This is Jean Rene, my dear friend from Medicine International Partners and Medicine CPC. They help us to carry those instruments for us. They pay some of the like the microscope, all other stuff, enormous contribution from all other NGOs. And also I traveled like in the United States, in all other the place wherever I go, I always have another extra suitcase to deliver some instruments, some microscope in those centers. So far, like in last 4 or 5 years, we reach out like 45 LMICs and 85 centers and donate over like 160 microscope training kits and combine them with real surgical instruments that they can use in on the patients. And this very briefly like shows the countries that we were able to send our microscope, our training kits, and also like the surgical instruments. And after sending out those instruments, we organize live stream training with some of the centers to teach them what we are doing here, so they don't have to travel here to learn the basics of microvascular anastomosis techniques, microsurgery techniques, even though we provide lots of other opportunities if they can. But this is something that whoever cannot travel and come to our lab to learn all other techniques, at least something to introduce them. And also we shared our offline sources, like over like 15 hours training videos that they can watch by themselves, also apply by themselves. Those are the most basic trainings that like people mastered in United States in the end of like 60s and beginning of the 70s. And since last like 60 years, it didn't change a lot because those are the most basic things, the alphabet of the microsurgery training. So they can do it by themselves. Then we also like collect our microscope here, the kits, and traveled in some of those centers, and with a suitcase full of microscope instruments and organized courses. 1 day, 2 day, 3 day, different type of courses we organize, and to initiate such training in those countries. And wherever we went, we organize a 1 day, 2 day, 3 day slingshot program to give an impulse to start such training in those centers, and share our offline training sources, and left couple of our kids in those institutions, so they don't have to travel even outside of their institution. They don't have to deal with visa issues to go other high income countries. They don't have to pay anything, so we provide everything for free in their institution, and we enable them to move on after we left. We share our offline sources, we share our training kits, left them there to make them like move on after we left. Those are the couple uh, courses that we done so far, and we've been in 7 countries, 13 cities, and trained over 300 people for free in those slingshot programs. And those are just couple pictures from each center that we have been. And we also advocate what we are doing to initiate a know-how and how we do it. We gave lots of online webinars and traveled in those centers, and shared people what we are doing. And we attend like the big congress here in the United States, all over the world, to present our stuff and to connect with more and more colleagues from low and income countries. This is one of the good examples. Like we had that neurosurgeon, Dr. Jayan Shah, a really good friend of mine from India. He just came here. He was like 3 year attending surgeon in his institution. He completed our training, basic training, and went back to his home country. And one day he sent me that video that he performed state of the art bypass surgery on a patient, and it was successful. And that shows us what people can achieve even with the basic training, dedicated training. And those are just couple pictures that what people are currently doing with the donations that we have done. They start the courses, they do teaching sessions for their med students, and for their residents, their colleagues in those countries. And we also start publish whatever we achieved. And this is the first paper that we published, and it got very good acceptance and very welcome by the community. And lots of people reach out after reading that paper and ask for collaboration to initiate similar things in their countries. And this paper, like this year, was awarded a Global Neurosurgery Paper of the Year by the Congress of Neurosurgeons, biggest organization in the United States, and we got the award a couple months ago. And I would like to thank you, my mentors, Dr. Dempsey, for your guidance, my other 2 mentors, Dr. Baskaya and Dr. Ture, also Professor Eshagil, the father of modern neurosurgery. And also a special thanks to my wife to allow me to spend a lot of time and effort in this work. So I would like to have, if you have any questions.
Wonderful. Thank you so much, Dr. Keles, for sharing the incredible story of MMI and the impact it's having on neurosurgical training worldwide. Your work really beautifully illustrates how creativity and dedication and collaboration can overcome resource limitations. So building on that global perspective, I'm now excited to introduce Dr. Yannick Canton Kessely to share his experiences expanding surgical capacity in resource-limited settings and working with MMI to support emerging programs in Africa. Over to you, Dr. Kessely.
Good morning.
Good morning.
Okay, can you see the slide?
We cannot see your slides, but we can hear you.
Okay, is it okay?
We can see your slides, but in the not in the presentation mode. So if you wanted to select that button at the bottom right. next to the magnifying. There you go. There, we can see our slides. Thank you.
Okay, thank you very much. Thank you for giving me the opportunity to attend to this meeting with the great people of neurosurgery like Baskaya, Keles, and all those people. My name is Yannick. I'm from Chad. I'm a neurosurgeon working at the University of N'Djamena in the hospital called Renaissance Hospital. I would like to share with you the contribution of the UW Global Fellowship in the development of neurosurgery in my country. My country, Chad, is a country located in Central Africa, with on the north Libya, west Sudan, and in south we have Cameroon, Nigeria, and in the east we have Niger. The population total in population is about 17 million. After finishing my training in 2015, I came back to my country and I faced a lot of kind of neurosurgical pathologies, and we have a huge challenge. The challenge was about equipment and training. And to tackle this challenge, we try to find a solution looking to the center where we can have more possibility to get more training. And with the ANS scholarship and with the authorization of the head of the department of UW Madison, Department of Neurosurgery, we came to Madison to continue our training for 3 months. And our objective at that time is to work in the anatomical lab, skull-based, to learn skull-based approaches, and also to learn microsurgery. Those things are not available in our area when we were training in neurosurgery. We spent 3 months in the Madison Neurosurgery department, and we used this time to learn microsurgery training. At the end of our training, we came back to our country, and we were able to apply some approaches learned there, like OSI approach, anterior clinopectomy, interhemispheric approach, retrosigmoid approach, far lateral approach. And with what we learned from microsurgery, we were able to do AV fistula. This is the image of the first OSI approach that we did once back to the country. This approach were used to take care about many kinds of orbital tumor. We performed around 17 cases of orbital tumor by this approach. This same approach helps us also to take care about some traumatic cases like orbitocerebral wound by aero, illustrated here by this image. We had the opportunity to learn some approach of the skull base and to how to deal with aneurysm in the brain. Once back, we use these ways to take care of some aneurysm, like so you can see here in this picture. At that time, I have the opportunity to meet the wonderful people like Jean-René from CBC and late Abdullah Keles from MMI. And those people help us. After my coming back to my country, they send us a lot of neurosurgical instrument, also training microscope and operative microscope. Those instruments have been used to train the other surgeon of my hospital. You can see in this picture many different surgeons of the hospital trying to do the first bypass. We have the ophthalmologist, urologist, orthopedic surgeon, and also my colleague neurosurgeon. This training is also shared with the medical student. We try to start to learn to teach medical students to do the different suture with this instrument that we receive from CPC and also from MMI of Madison. After my coming back, I maintained the contact with the neurosurgical department, also with people of CPC. And in this picture, you can see Jean-René and Abdullah. They came to the CAA and NS that is the Continental African Association of Neurosurgeon Society. And during this meeting in November, they shared around 47 microscopes to many different countries that have been there for the meeting. Okay, 6 years after finishing my training in Madison, I had the opportunity to come back to Madison in May 2025. And during this during the microsurgical meeting, I had opportunity to make a restitution of what I learned from there and what I applied in my country. And I share also all kind of pathology that we faced in our area. I would like to insist on something. We say that we finished the training, but once we came back, we continue still remain in contact with our mentor, and we organize many kind of webinar with Professor Baskaya. One of them the first of them was organized in 2020, and we also keep in contact with Professor Baskaya for some cases that are very difficult. Like you can see in this image, it's a kind of it's an aneurysm of the terminal carotid, and it was very difficult for us to deal with that. And for that, we organized a webinar with Professor Baskaya through the help of Keles, and he still continues to give us advice how to deal with some cases. I would like to also thank CPC and MMI because they provide to my department on May 2025 many instruments. We want also to thank Erin and also Medtronic that gave us all those instruments to help us to continue to work in our department. On this 1st September 2025, we opened the first neurosurgery department in the country. And during this meeting, this opening of the department, all the 7 neurosurgeons working in the country were gathered in the same place. And during this time, we also opened the first microsurgery room, and this microsurgery room has been visited by many officials and also different surgeons for different area. They can come and try to do some suture in this lab. That is our microsurgery department. We have for the moment 10 stations. I would like to share with you this image. At the opening of the department, we try to do also to take care of all the patients with hydrocephalus, and this taking care was free. The other neurosurgical activity that we used to do in my department are different. We have a lot of cases of traumatic, even though brain traumatic or spine traumatic, and we try to perform some approach. As you can see it on the first arm, we did C1, C2 arms. We have prosthesis, vertebral prosthesis. We have a lot of kind of malformation like of encephalocele, the tumor orbiter, the brain trauma, and also hydrocephalus. I would like to share with you this image. This image represents the people in one of the main street of my country, and you see that people don't use helmets when they are using the motorcycle, and those are one of the reasons for why we have a lot of cases of traumatic brain injury or spine traumatic injury. Thank you for assisting.
Excellent. Thank you so much, Dr. Kessely, for sharing both the realities and opportunities within your setting. Your remarks really provide an essential foundation. So as we continue today's conversation, we do have a question here in the chat for the both of you. It says, "This is really great. I'm wondering, since it's cheaper and possibly more relevant for African surgeons to go to Chad for some training, but obviously there is more resources and expertise in Madison. Could there be a sequence of training, meaning surgeons from Africa might first go to Chad for a few months, and once certain skills are mastered, if appropriate, then they could move on to skills at Madison?"
Excuse me, can you repeat the question, please?
Sure. The question is, would it be more resourceful for folks to go to Chad and receive training there first and do like a sequence of trainings in Africa before then coming to Madison for additional training?
Yeah, thank you very much for the question. For the moment, we don't do neurosurgical training in Chad. We aim to start neurosurgical training. All the neurosurgeons that are working in Chad have been trained abroad of Chad, in the country like Cameroon, Morocco, some of them from South Africa or from Japan. But at the end of our training, we used to go for a year or for 6 months in another country like France and other countries to have more experiences. But we are planning to open maybe in 1 or 2 years the neurosurgical training in the field.
Great, thank you. Another question for both of you. There have been many challenges with startup and implementation of these programs and trainings, but now that these programs are well established, what are some challenges you are currently facing?
I think,
Okay,
yeah,
the challenge
I
that we
can,
have
yeah.
with training here is the lab. We don't have a cadaveric lab. Me, I think that the opportunity that I have is when I came back, I came to Madison. That's the first place where I found a cadaver in a lab. That's it's the first challenge. The second challenge is that we don't have all instrument, different kind of instrument to deal with every kind of pathology. We have been trained for some pathologies, but the lack of instrument is the problem. But I think that we hope that we will find a solution for that. And the other thing is also the lack of the training. We don't, for the moment, we are all just a general neurosurgeon. We don't have sub-specialty in neurosurgery because we are seven for a population of 17 million. And those seven neurosurgeons are all working in the same town. Because in the other city, we don't have CT scan, we don't have the availability of material to do some surgery there. Those are the difficulties that we for the moment we face with.
I think, yeah, I can answer both of the questions. The first question from Joan Rene, thank you for him for the organization, and we established a really beautiful place as Yannick showed us in the pictures in chat. And we plan to chat became one of the centers that like for the basic microsurgery training. So that's why we established as much as microscope in chat and with all other stuff. So in microsurgery training, in neurosurgery, the basic training that we mentioned is microvascular anastomosis training that everybody should done. But beside on those, as Dr. Baskaya present, like they need to also do the cadaveric dissection in the lab to learn the anatomy, learn the surgical approaches, the microvascular anastomosis training, the basic training that we provide gives the skills, but not the operation like knowledge, operation like the anatomy. That's to be able to get that part of the training, they have to travel. Still, they have to travel if they don't have any cadaver available in high income countries to get it done. So even though like some people can travel to Chad, and I think like Yannick is willing to open the lab for everyone from Chad who like from the Africa, whoever would like to do some training, but this is just basic training. So and if they would like to do more, and if they have any chance to move, like come to United States or travel to other places, they have to do more and more to apply those techniques on the patients. For the second questions, the challenge that we have, even though we establish like those, we send out those training kits to it's always hard to convince the people do such trainings. It's because like mainly like in most of the countries, like people don't have time. They don't have any support from their institution. They don't have any like materials to work on. That's we did our best to provide the most basic instruments and a microscope. That's the hardest things to find in those countries. So still they need to get more like sutures they can get from eBay or from other sources from China for low prices, but they should understand well that they need such trainings. That's the first step to be aware of that they need such training and And it's really hard to like convince people after some travel, like training in neurosurgery, to they have to go back to the lab and do some training. So if they needs that they have to do it, then the more success comes through it.
That's great. Thank you. And basically takes us to our next question, really in alignment with what you were just saying. The question is for Dr. Kessely, but I think this could go to both of you. Are you able to accept donations of tools for your program? If so, how do we ship them to you? And what would you be looking for?
Okay, thank you for the question. I think that we accept donation for our program. We need many things to continue to teach or to learn. And the second question is how do we ship them? For shipping, until that moment, the people that help us very much is people from CPC, Christian Presbyterian Church. I think that one of them is seeing here the meeting. His name is Jean-René. They used to help us for shipping those kind of instrument or the donation. Maybe we will get in contact with them and we will see if it is possible to do it for this moment. And also, what would you be able looking for? You want every kind of donation for training or for the neurosurgical working, because we have a lot of case of patient, many case, traumatic, brain tumor, every kind. And we don't have a lot of instrument for each different kind of those pathologies. And we accept every kind of donation.
Yeah, good morning, everyone, and thank you so much for the opportunity. I want to thank Dr. Baskaya, Dr. Canton, Kessely, and Dr. Abdullah for all the work that they have been doing with this initiative. And we came in as a community partner to support this initiative. And I was able to travel to Chad in 2023 with 13 microscopes and be able to help establish that first microsurgery lab. And one of the things that really touched me there was that I spoke to one of the neurosurgeons who told me, I came back to this country after my training 3 years ago, and I never had the opportunity to use a microscope in my work. I'm so glad that I will have that opportunity now. And as Dr. Canton Kessely said, they did not limit that only to microsurgeon, but they also to neurosurgeon. I'm sorry, but they also extended to all the other doctors in the in Jamena actually. And secondly, Dr. Kessely, with the connection that he made with us, did not limit himself or limit the impact of what he received to Chad. Our ambition was to create a regional lab where neighboring countries' surgeon can come to Chad to get the microsurgery. But Dr. Kessely went further by establishing a connection with the network of neurosurgeons in all Africa. And we went to that Canton Congress in 2024 with 45 microscopes. And we were able to, Dr. Abdullah Keles was able to train the neurosurgeon there in microsurgery, but also to equip 23 centers across Africa with microscopes and other microsurgery instruments. So now we have 23 centers in 19 countries that are functioning because of the donation or because of the connection that we made here. And now to answer the question, we accept donations. And the best way to get the donation there would be to travel to Chad, because Chad is a landlocked country and it's very expensive. We received a donation from Medtronic of shunt, and we just shipped a suitcase there. It was quite expensive, about $2,000 for a suitcase that weighed less than 20 pounds. So depending on what kind of instrument. But we have a medical team, a surgery team that might travel in Chad in May. If that happened, that would be the best way for us to take it there because we can fly with that and it'll be cheaper. Thank you.
Wonderful. Thank you so much for providing that perspective. That was really helpful. Dr. Keles, do you have anything else you would like to add to that, or talk a little bit about how some folks can become collaborators with MMI?
Sure. Yeah. Thank you, Joanna, for your contribution. It's amazing work that you have done for Africa and for Chad individually. And we always truly appreciate your contribution. So like right now, like we reach out like 45 countries and 85 centers, and the main aim what we are doing is we cannot reach out like another 100,000 centers right away, and like we make this in a sustainable way. So what does it mean? So whatever we are doing, for example, those kits that we purchase, like most like a personal donations, and they are not too much expensive, but people don't know which kind of instruments they need, what kind of like microscope they need. That's what we are providing right now. So with the publications, we are showing the way to people to do the same thing. We did it in 45 countries, but whoever wants to do the same thing, they don't have to do it in 45 countries, 85 centers. So they should able to purchase the microscope correct instruments for such training, initiate such training in their home institution. That's what we are providing. So after like we publish initial paper, lots of people reach out to us. Some of them was able to come to our lab, have some training, and whenever they are going back, we donate them the kits, or we guide them to purchase their own kits, and they purchase with their own money. So it's not about like that much about the money itself. So we are providing know-how, what kind of microscope they need, what kind of like instruments they need, where they can purchase those. And another good example. So we were in Kinshasa, Congo for that CANS meeting, and we met like really beautiful colleagues there, thanks to Yannick and all our organization and Jean to make this happen. And like a couple of people reached out to me after the congress, and they said, okay, I'm from Morocco, I want to have my own kit, how can I get the kit? So and we sent email back and forth, and I said that if you are able to travel United States even just for weeks and for a congress, then you can get your own kits. I can guide you where you can purchase. I can share the eBay links that you can just go ahead and purchase the kits. Or if you cannot make it to United States, then we are closer to Europe. If you can purchase something from Europe, if you are just visiting like France or any other European countries, I can share the similar things. I can share just couple like links with you, that cheap, reasonable price microscope training kits, and that's what we did. Like he had some relatives in France, living in France. I shared like couple eBay microscope like kits sources from that country. They purchased it, and just in a couple of months, he was able to deliver them to Morocco. So I'm here in the United States. He's in Morocco, and he got a microscope from us in just a couple of months. So once you get it, then that's all done. So you can use it for forever, for multiple years, and those are the kits, like smaller kits. You can transfer to other hospital. You can take it to your home, and like like it's affordable, and like mobile training kits. So right now that's what we are doing. So if that could be achieved, that's I think like the MMI will like finish its aim, like purpose, like because like even though like we should accept like more donations, but still lots of travel to deliver them in those countries, and it's not the best way to do it. So best way should be come from the people, whoever would like to do it, they should able to know how to do it. So that's what we are providing, and we already published a couple more papers that's to guide the people what we are doing, and we are always open to people to guide them online. We did lots of like online Zoom meetings to initiate such training in those other countries. People reach out to us even from Europe, like Balkans, and they would like to establish a lab, and we guide them and to get the correct things. And yeah, that's I think the right now this is the part that we focus on more. And also like we reach out 85 centers, 45 centers, we send our donations, but like in some of time we don't have any response yet. We don't know how they are doing, so we will do one by one like collaborations with them and focus on them to initiate such training in those countries in a correct way.
Great. Thank you both so much for sharing how to get involved and how to support the efforts. What advice would you give to institutions or individuals who are interested in starting a similar global surgical training collaboration?
What suggestions? So the first needs comes from like people that need it. That's the main thing. If they don't want to train, like if they don't see you, what does it make difference in their surgeries? Nobody can make it happen. That was like initial like the problem. So first, like even for our international fellows, first thing that we ask them to do it for like basic training. We share them lots of sources, videos like from the pioneers, books. We want them to understand why we need such training. That's the main thing. So if they don't understand what they need such training, then they don't continue. That's like the one of the biggest challenge that we faced. And yeah, like first they read a lot because those techniques are not new techniques. Those are the basic techniques, the alphabet of the like the skills training. And people did amazing job until like 18, middle of 18, since beginning of 70s. And we just need to go back, read from those people and inspire by them, and just replicate what they ever done. And yeah, it's kind of challenging in other countries, but we should try to do our best to like get most of every kind of opportunity. So whenever they are traveling to other countries, they start to like keep looking for some more like instruments or training materials, and to reach out like the people like me to guide them. Or there are lots of other organizations that's helping like the people in need with the instruments or with the training. So those kind of things available, they should definitely read more and find those kind of sources.
Wonderful, thank you. Dr. Kessely, what role has the Ministry of Health or other local institutions played in assisting with the short or long-term sustainability of your neurosurgical training programs?
Okay, thank you very much. I see that's a big question. I think that the fellowship of UW help us a lot, I can say, because I used the opportunity to learn that many approaches that I did not knew before. And once I came back to my country, I help a lot of patients with those kind of approach. Some diseases that I could not deal with after coming from UW, some of them I can deal with them now. And as we work in team here with neurosurgeon, I try to share this knowledge to my colleague neurosurgeon. And my hope to them is to have the same opportunity to come and to learn in this kind of lab. As Professor Baskaya said, he said that we have to see, to practice, to go to the lab on the cadaver many times. And it is really necessary for that. This other thing is that I had during this time also the opportunity to learn to microsurgery. And when I came here, for the patient who have a chronic failure insufficiency, we try to do the AV fistula for those patients before that the vascular surgeon start to come back to the country. The other thing is that I met a lot of people that wonderful people there. Some of them are surgeons. They open my mind of the neurosurgery. I see the neurosurgery in other frame now. It's not the same thing that I had in mind before coming there. And the other thing, I meet also really good person, like people of CPC, like Keles, SIMA, and many other things. And I try to keep in contact with them. Once I came back, the first thing that I do is to speak about what I learned to Madison, to all my colleagues of Africa with whom I was in contact. And they asked me, can you try to do that? We have a meeting with Professor Baskaya. And I contact Professor Baskaya, and he said that he can share with us something. We have to choose the pathology, and he will speak about that. And that was the first time that Professor Baskaya make a webinar from all the neurosurgeon from Africa. I think that I learned many things from there, and I want to thank all the team, and I thank also God to give me this opportunity to come in this city. When I was leaving Madison in 2019, I never thought that one day I will come back there. But I had opportunity to come back also again in 2025. And I thank everybody. I thank CPC, and I thank God for that. Thank you very much.
Great, thank you. Unfortunately, that is all the time we have for today. But what a wonderful highlight of really illustrating what makes MMI so extraordinary, reminding us all that meaningful global impact doesn't always begin with large budgets or formal programs, and that sometimes it really does just start with a simple realization and a willingness to rethink the tools we already have and the determination to make training accessible to everyone, no matter where they live. On behalf of UW-Madison and our global health community, I want to thank Dr. Keles, Dr. Baskaya, and Dr. Kessely for sharing your insights and for your continued dedication to strengthening neurosurgical training worldwide. And thank you to our audience for joining us today and for the engaging discussion. We hope you'll stay connected as MMI continues to grow and transform opportunities for surgical education across the globe. Be sure to visit our website, ghi.wisc.edu, to learn more about upcoming webinars and find today's archive video. Our next webinar is on Tuesday, January 27th at 9 a.m. Central, where our panel will explore the local to global rise in antimicrobial resistance. Thank you, everyone, and I hope you have a wonderful rest of your day.
Thank you. Thank you, Calyn. Thank you, Kate, for the organization. It was great to be with you here today.
Thank you. Take care.